In this video, we are going to examine the anatomy of the paranasal sinuses. The paranasal sinuses are paired cavities in the bones of the skull that are formed during fetal development, when part of the bone tissue is replaced with the nasal mucosa. They remain connected to the nasal cavity after birth. The specific feature of these sinuses is that their mucous membrane is very firmly fused with the periosteum. Watch more videos in the EasyAnatomy app. With EasyAnatomy, you can learn much easier and faster. We provide a comprehensive video library, related PDF notes, and atlas sections with engaging flashcards. Download EasyAnatomy from the link in the description. There are the following large sinuses. The maxillary sinus, which is located in the body of the maxilla and is pyramid-shaped. This sinus has the following walls. The medial wall of the sinus, which is also the lateral wall of the nasal cavity. This sinus communicates with the nasal cavity by the maxillary hiatus. There is also a place in the area of the middle nasal meatus where the wall becomes thinner. The anterolateral wall, which has no openings. However, in its middle section, there is the canine fossa, which is the thinnest spot. It is used in surgery to open the sinus cavity. The posterolateral wall, which adheres to the cells of the ethmoidal labyrinth and the sphenoidal sinus. The superior wall, which is the thinnest wall of the sinus. It is also the inferior wall of the orbit. This area is very important from an anatomical point of view, since the infraorbital neurovascular bundle passes here. The inferior wall, which is the alveolar process of the maxilla. Sometimes the roots of the teeth may protrude into the lumen of the sinus. This increases the risk of inflammation in the sinus. The frontal sinus is a paired pyramid-shaped sinus, which is located in the squamous part of the frontal bone. It has the following walls. The anterior wall, which is the thickest and is formed by the facial surface of the frontal bone. The posterior wall, which is quite thin but strong, bordering on the anterior cranial fossa. The inferior wall, which is also the superior wall of the orbit. It partially borders the cells of the ethmoidal labyrinth and the nasal cavity. On the inferior wall, there is a canal of the frontal sinus through which its cavity communicates with the nasal cavity. The medial wall, which passes between the two frontal sinuses and serves as a bony septum. The sphenoidal sinus is a paired sinus located in the sphenoid bone. The superior wall of the sphenoidal sinus is the inferior surface of the sella turcica. The pituitary gland adheres to this wall. The inferior wall consists of the wall of the nasal cavity and the fornix of the nasopharynx. The posterior wall is formed by a part of the occipital bone. The lateral wall is quite thin. It is part of the sphenoid bone and borders on the cavernous venous sinus and the internal carotid artery. There are also a number of nerves, including the oculomotor nerve, the branch of the trigeminal nerve, the trochlear and abducent nerves. Sinuses of the ethmoid bone or the ethmoid labyrinth. The sinuses of the ethmoid bone are actually cells inside this bone. There are up to 10 on each side. They are formed by thin bone laminae and have different shapes and sizes. Based on their location, there are three groups of these sinuses. Anterior and middle sinuses, which communicate with the middle nasal meatus, and posterior sinuses, which communicate with the superior nasal meatus.